All right, let's get started. My name is Victoria, and on behalf of the Education Work Group, we'd like to thank you all for coming to our June Lunch and Learn presentation on insights from COMIRB. A few housekeeping items before I introduce today's speaker. First, we will be recording today's presentation, which will be made available on the internet over the next few days. Second, everyone present here today will receive a certificate for their attendance. Today's presentation is eligible for 1 continuing education credit, which will be listed on your certificate. Third, we will have a short survey after we end for the day, so please take a few moments to fill that out. We would love your feedback on today's presentation. And lastly, we do appreciate and strongly encourage your questions. However, please hold your questions to the end of the presentation. And now I have the privilege of introducing today's speaker. Elvia Daniela Lozano Ortiz is an IRB review specialist at the Colorado Multiple Institutional Review Board, otherwise known as COMIRB. Elvia received her Bachelor's of Science from Ohio State University, where she majored in biology with a focus on public health. During her time at Ohio State, Elvia conducted epidemiological research on cancer in the Latin population of Columbus, Ohio. This research sparked her interest in the world of research administration. Elvia began her time at COMIRB as an IRB panel coordinator and worked to become an oncology panel specialist. As an IRB specialist, she focuses on reviewing exempt and non-human subjects research, in addition to helping research teams navigate their IRB submissions. In her upcoming presentation, Elvia will review the COMIRB submission process and give out some helpful tips on how to prepare your research for IRB approval. I would like to take a moment to thank Elvia for being here today. We'll give her a moment to pull up her slides, and then Elvia, the floor will be yours.
Thank you so much for the introduction. Let me share my screen really quick. Okay, you should all be seeing my presentation now. So hi again, my name is Elvia. Like Victoria just said, I'm a specialist at COMIRB. I work on panel D, which I will describe in a couple of slides. So for today's presentation, we're going to give an introduction to COMIRB and what panel D is. We'll define a couple of baseline vocab words that we'll be using throughout the presentation. We'll go over what non-human subjects research is, what human subjects research is, what it looks like to have COMIRB be the IRB of record, as well as a little bit of an insight into what submitting to COMIRB looks like and what the process looks like on our end. So starting off pretty basic, what is COMIRB? We're an institutional review board, so we review all human subjects research for legal and ethical compliance for University of Colorado, Denver, the Anschutz campus and downtown Denver, the Children's Hospital of Colorado, Denver Health, UCH, as well as a VA system. And then we also have an MOU with the School of Mines and a couple other institutions that we oversee as well. Not everybody that works in research has to come to COMIRB. There are multiple different types of institutional review boards. There's some studies that choose to use external IRBs because of funding or other requirements such as WERB. So we don't see all of the studies that are conducted by CU researchers, but we see a good amount of them. And as we review these studies that are submitted to us, we really are focusing on protecting human research participants' rights and welfare, and then also making sure that we facilitate the research being done in the most ethical way as possible. And we try to do that by providing high quality, timely, and consistent reviews of each study that we receive, as well as providing customer service for researchers and research personnel to make sure that you have effective consultation and training before you even submit to us. And so a little bit more about COMIRB. We consist of 5 different IRBs, which we call panels, just to avoid confusion. So we have panels A and B, which are adult biomedical research, and they meet twice or every other week. We have panel C, which is pediatric biomedical research. They meet weekly because they have a little bit more of a workload for studies. And then we have panel D, which is the one I'm on, which is adult oncology and high risk research. We see a lot of cardiology studies as well. and we meet every other week as well. And then for panel S, this is our social and behavioral kind of catch-all panel. For all of the studies that are on panel S, they can't involve HIPAA. So sometimes we have research that is social and behavioral focused on different panels just because they're looking at private health information. And panel S meets a little bit more sporadically. Most social and behavioral research is minimal risk, so they don't require that the board convenes as regularly as other panels. So they typically convene maybe 2 or 3 times a year, but mostly on a needed basis. For our leadership at COMIRB, we have our institutional official, who is Dr. Allison Lakin. Then we have John Heldens, who's our director. Kat Sutherland is the assistant director, and she's also my interim manager. And then we have Ryan Lowry and Matthew Hamilton, who are managers for panels A, B, and then C as well. For panel D, we have 2 chairs who are in charge of running our full board meetings, where all our panel of experts convene to review studies. So firstly, we have Dr. Ginger Borges. She is our latest addition to the team, and she is a medical oncologist. And then we also have Steve Bartlett, who's been with our team for a long time and has just been consistently there for us, and he is a VA research pharmacist. In terms of staff, we have my interim manager, Kat, who's also the assistant director. There's me as the specialist, and then we have 2 coordinators by the names of Evangelina Espinoza and Caroline Gabrielle. They do a lot of the groundwork in terms of making sure expedited submissions get pushed along through the initial application process, any amendments get pushed through, and they also do basically all of the work to set up the agenda for our full board meetings. So if you're working on expedited or full board research, you will likely have a good amount of contact with them, but they're both amazing. You're in great hands on that side. And then before we go any further, we'll go over some definitions. So both of these definitions are established by the Office for Human Research Protections, or OHRP, and that's what we look towards for guidance. So firstly, we'll define research. So that is a systemic investigation that's designed to contribute to generalizable knowledge. The most important pieces there are systemic. So the investigation has to be something that can be recreated. And then the intent, it has to be meant to contribute to generalizable knowledge. So sometimes people create systemic investigations just to figure out if the program that they're implementing is effective. That isn't designed to contribute to generalizable knowledge. It can't be applied to a university out in California. So that for us, even though it's systemic, wouldn't be research. Then for human subject, that is a living person about whom an investigator obtains data through interventions or interactions, or they obtain identifiable private information. So really, you can obtain information from a living person that isn't about them, right? So sometimes you ask them about their professional opinions, you ask them about the processes that they have in place in their office. Those, because you're not asking that living person about themselves, then they wouldn't be counted as a human subject for us. And then sometimes you don't even interact with a participant in your study, right? Sometimes you are just pulling records, their medical record, you're looking through their charts, and you're not having any contact or intervention because you're still getting access to their identifiable private information for research. They are considered a human subject. So when one or both of these conditions aren't true, we have a category called not human subjects research. This is typically research on, like I said earlier, processes or professional opinions, publicly available data, so social media. Sometimes there's public Facebook groups that you can pull data from. You can look at journalism, and then you can focus on improving programs, evaluating programs that you have at your institution. And those for us would not be considered human subjects research, so you do not need to submit them. There is a special caveat for a specific category of research that does need to be submitted to us, and that's if you're doing research that involves the health information of deceased people. This is a little bit tricky because they're deceased, right? So they don't fit the definition of a human subject, but they still are protected under HIPAA. So you need to submit to us so we can grant you a HIPAA waiver, and that way you're covered to look at their health information and their medical records. Then we have human subjects research, which is the bulk of what we see. there are 3 different types of this human subjects research. There's exempt, expedited, and full board. Exempt is the lowest review category in terms of really difficulty and regulations we have to keep track of. So these studies aren't subject to federal regulations, but they are subject to the regulations of the institution and of the body that's funding it, and any local policies, local laws, etc. And they also have limitations for the inclusion of vulnerable populations. So for example, if you want to look into anything that has to do with prisoners, your study can't be exempt. So you can always reach out to us if you're not sure if a vulnerable population would disqualify your project from exempt review. But if it does, we would just bump it up to expedited, which is the second tier of review that we have. This is for minimal risk studies. And essentially minimal risk for us means that you're not causing any harm or discomfort to a participant that they wouldn't encounter in their regular life or in their regular, doctor's appointments. And so there's a lot of research that can fit into that category, as well as the full board category. So full board is everything that essentially doesn't fit into the previous categories that I've talked about, and that does increase harm or discomfort towards the participant. So for expedited and exempt research, we have further categories that just kind of classify the study into what it's really looking into, what the interactions consist of. So I'm going to go through what those categories look like next. So for exempt research, there are 4 categories. The first one is research on educational practices. And there's a big point here that I want to make sure you know is that educational settings aren't always, K through 12 or college classrooms where you're giving a survey, you're giving a test. There's a lot of settings that can be considered educational and that you can do research on under this category. So for example, sometimes patients take classes to learn how to navigate their life with a chronic condition or with an acute condition. You can do research on those educational settings and it will still fit under this category. You can also look at the students that are learning or the educator that is giving the information. And then overall, this one, again, can't increase risk or discomfort to the participants. Then we have category 2, which is really more social and behavioral focused. So this is research that includes surveys, focus groups, interviews, interactions like that. In this category, you can't have any children if the PI is going to be involved. So if the PI is going to be interviewing a child, this will automatically get bumped up to expedited. But you can ask a parent about their child's experience and conditions. So there is some sort of way to work around, but if the PI will be interacting with the child, it won't fall under this category. And then also something that gets a little bit misconstrued is people think that you cannot have identifiers for exempt research. You can. So we just need to know what identifiers you're going to have, how you're going to store them, if they're going to be, connected to the rest of the data, or if they're going to be completely separate from the main bulk of data that you're going to be analyzing. We just have to know that, but you can have identifiers in your study. And then category 3, this is a really rare category. It was created with the 2018 Common Rule as kind of a catch-all. So this is for research that involves benign behavioral interventions for adults who consent when the information collection is limited to verbal, written responses, or audiovisual recording. So for this, think of you're going to put a participant in a room that's playing rock music and then survey them on how they feel leaving the room. You'll put them into a room that is playing jazz music and you'll survey them. So these are really rare for us to see. We get excited when we see a category 3 come in and we all kind of have discussions about it. But the main point of this research is that intervention has to be brief in duration. There can't be any pain involved. No harm can be done to the participant, and it can't be embarrassing for the participant to participate in it. But in overall, most research falls into different categories. This is one of our least used categories. And then the last category of exempt research is what we call secondary research. This is its own special thing. We have an application form just for the secondary use of data. We have a secondary research protocol, all geared towards this category, just because for this, you're looking at data that was collected for purposes other than your research. So you're pulling data from charts, you're looking at a previous study that had a different research question, you're looking at data banks, all of that data wasn't collected with the intent of answering your research question or looking into your research idea, right? And one of the biggest misconceptions about this category, and we also have a part to blame, COMIRB has a part to blame in that, people believe that the data needs to exist when you apply for IRB approval. Our application is outdated and does say that, which is why I say we are at fault for this misinformation, but the data does not need to exist. That is an outdated rule. We're working on an updated application that will hopefully be released in the coming year that won't have this in there, but just know that you can look at data that was collected and input into the medical record, into a data bank after your IRB approval, just because that data was not collected for your research. It was collected for the purposes of the patient's treatment or the data bank. So this is just for kind of a catch-all for that type of research where you're not interacting with subjects, you're just pulling data from different sources. And then we will move into expedited review categories. So there's 7 of these that are a lot. They're kind of splayed out a little bit more than the exempt categories, but there is some overlap between them just from when we have to bump studies up to expedited review or from before exempt even existed. So the first category is for clinical studies of drugs or medical devices where an IND or an IDE isn't required. So you can still use drugs and medical devices in a way that it wasn't intended for, so off-label use, as long as it doesn't increase risks to subjects. So keep in mind that's one of the biggest kind of conditions that need to be met for expedited review is that the whole study has to be minimal risk, right? Moving into category 2, this is a collection of blood samples by blood draws. There are some limitations for how much blood you can draw. So for non-pregnant healthy adults, you can have up to 550 milliliters in an 8-week period. And for everybody else, adults and children, you have to choose the lesser of the 2 options. So either 50 milliliters or 3 millimeters per kilogram of weight in an 8-week period. And then for both of those populations, the collection can't occur more than 2 times a week. So when you're applying for a study that's going to be doing blood draws, you want to make sure that you're meeting these requirements if you want expedited review. For category 3, this is a collection of biological specimens by non-invasive means. So that is maybe taking a cutting of hair, teeth that were already extracted, using saliva. The placentas are something we see a lot as well, and then nail clippings too. So that's something that is not invasive for the patient to give you that sample. Category 4 is for non-invasive procedures that are routinely employed in the clinical practice. So this would be like ultrasounds, EKGs, exercise testing, etc. You can't have any procedures that involve x-rays. So a lot of times people miss that DEXA scans fall into that x-ray category. You can't use microwaves, general anesthesia, or sedation because that crosses the line into more invasive. And you also cannot have a study that is intended to evaluate the safety and efficacy of a medical device that almost always goes to full board just because you're evaluating safetiness, right? That there's some gray space in terms of risk there. And then category 5, we use this category in a very limited capacity. So this is research involving materials that have been collected or will be collected for non-research purposes, which is essentially the same as exempt category 4 or secondary research. But we use this category whenever your study can't be exempt. Maybe you have a vulnerable population, the PI is a student, and the study needs a couple extra set of eyes that are looking over all the regulations to make sure that all of the regulations are met. And so this is what we have that category for. Category 6 is if you're collecting data from voice, video, digital, or image recordings that were made for research purposes. So this category, just like category 5, you'll likely never find a study that is just category 6. It'll be category 6 and 7, 6 and 2. It'll be a combination of categories for these. Then category 7 is, again, our social behavioral kind of catch-all. It's for research on individual or group characteristics. And again, this seems like category 2, but there's always something that bumps it up to need expedited review. Maybe what you're asking participants about is something that's kind of embarrassing or stigmatizing. There's a student that's running the project. Reasons like that, we would bump an exempt study to this expedited review category 7, or you could also have a study that, you know, is evaluating a drug, but is also doing a survey. So in that case, it would be multiple of those categories combined. But that is the last of our expedited review categories that I'm going to go over. We do have like, I think 3 or 4 more, but those you don't have to worry about. The board essentially establishes them, and they have like super specific requirements that you don't need to know. So just know that there's more than 7, but 7 are kind of the important ones for you all, for your purposes. And then the last type of review is full board review. So this is for research that is greater than minimal risk. And essentially the application looks almost the same. We need a little bit more information, typically just because these involve drugs. So we need to see investigational brochures and paperwork like that. But these studies, instead of being reviewed by just a chair or an expert, they would be reviewed by a convened panel. So this is where those chairs from my previous slides come in. Everybody comes into a meeting. We have an agenda of studies, and they go in for initial applications. We have a scientific reviewer and a non-scientific reviewer who make sure that, you know, things are easy to understand for somebody that would be consented into that study, right? And so we give these types of studies a little bit more careful of a review, and more conversations are had around these studies just because they present a certain level of risk to participants. And then I know I just gave you guys a lot of information that is very specific, so I wanted to have some time for questions if you have any right now, before I continue on with the rest of the presentation. So you guys can just unmute or put it in the chat. I'll keep an eye there.
Hey, Elvia, I had a question. So from the 3 types of reviews, exempt, expedited, and full board, approximately what percentage of those do you see come through panel D?
Panel D, yeah. So panel D, because we're more oriented to high risk research, we see a lot of full board studies. Sometimes we absorb some of those social and behavioral studies that come from panel S that involve HIPAA, but I'd say typically it follows the same pattern as the rest of the office, where expedited gets the most amount of submissions just because it doesn't need as much funding. And exempt also, we see more submissions because they're smaller projects. Full board will make up the least amount on any panel, just because, you know, there's a lot of steps that you have to get to before you can even submit a full board research study. You have to get funding, institutional approvals, those types of things. But we do comparatively see more full board studies than other panels. Graduate. Okay, I have a question from Lorna. Does graduate medical education come under exempt category 1? Yeah, so there is actually even a whole panel for research that's done on, well, actually what I'm thinking of is medical students, but in general, graduate students can do studies on their own educational processes or on different educational processes. So education, I know earlier I said it's not K through 12, it's not just college, it's the same thing. It can also include medical students, people that are in residency, anything that where one person is learning through a specific process and you're doing research on that process will fall underneath that umbrella. Of course. Okay. Any more questions? Okay, perfect. So I will go ahead and move on with the rest of my presentation. So there is a specific scenario where a study can be multi-site. It can involve, you know, CU Anschutz and Johns Hopkins. And when these studies are federally funded, one of these institutions has to have their IRB serve as an IRB of record. It's not always institutions like other universities. There's hospitals that get involved, community centers that can also be a site for a multi-site project. And when it comes to these situations, if COMIRB is a primary recipient of any funding, we will serve as the IRB of record. And that essentially means that we establish an IRB authorization agreement with the other institution. This is kind of a longer process, and a lot of it happens just administratively in the background. So if you ever have a study where it seems like there is a single IRB requirement, or there's too many sites and you want to remain the IRB, you want to remain the main site, we would become the IRB of record for you. And you can just reach out to the help desk or reach out to me, any COMIRB staff member that you know that you've been in contact with, and just let them know that this is what's coming up for your study. And we'll go ahead and give you a full guide on what the steps will look like. And we'll get that whole procedure started. But essentially what we need from you is just to know which sites you're going to be adding, who's going to be the PI of each site, and what they're going to be doing. We take that information, take it to our director, who can authorize if we will be the IRB of record or not, and then we'll go ahead and get started on the paperwork. This process is kind of sporadic. It's dependent a lot on communication times between us and the local PI, us and the team at a different institution, and our IRB and the other institution's IRB. So sometimes this process can take a week. That's usually what we see for community centers where they're on top of it. For larger universities or hospital systems that have their own regulations and they want to have their input on the study, this process can take months. So there's always a degree of variability. So we request your patience through it. We promise we're always trying our hardest to make sure that communication is as effective, but sometimes we're stuck without a response. But in general, this process will seem a little bit confusing because there are so many moving pieces, but whichever staff member you're working with will make sure that they're there to answer you any questions and communicate and break down any of the process. So just reach out to us in that case. And then I wanted to go into kind of a summary of what it is like to submit to COMIRB, what you should do before. So before you submit to us, make sure that you have completed all your personnel requirements. So we have city trainings. There's 3 modules that you may or may not have to do depending on your study. You can find more information on which one to do on our website. You have to disclose your COI yearly. The record is about to reset in August, so mark that on your calendars if you didn't already. That is coming up. And then you also have a current CV. You have to have a current CV uploaded into your InfoEd profile. For us, current is typically within the last 3 years, but we really just ask that it reflects your current position. When we're going in to prep your submission for review, we're checking to make sure that, somebody that you said is an investigator actually can be an investigator, or that the PI has a faculty appointment and isn't a student. So that's why we really look at those CVs. We're not judging you on your publications or anything. We're just looking at your current position. And then you will also need to compile your necessary study documents. Each type of submission has its own required documents, whether you're submitting for the first time, you're changing something in your study via an amendment, you're reporting to us that you had an issue via a UAP. Each submission will have its own documents. So we have a helpful website we have a helpful page on our website that has a chart that just lists, like, if you're turning in a UAP to us, this is what you need. So definitely make sure to check there. Our website also has template forms for consents, assents, as well as for translated documents like short forms. We have templates for all of that. So make sure to check our website before you start from scratch writing your own protocol, because we probably have a template for it. So check our website out and fill out all the documents that are required for your submission. Then you're also going to want to make sure that you submit to and you receive your institutional approvals. So for this group, you're likely looking at the human subjects portal. Each institution has its own requirement. So check in on that as well, but you also will likely need PRMS approval. Any oncology related protocol, whether it's exempt, expedited, or full board, needs to be submitted to PRMS because they review it for merit, priorities, and progress before we even see the study. And so when you're applying to us, you want to make sure to upload the clearance letter that you received from PRMS and the clearance letter that you received from the HSR portal. We gatekeep them with the initial application, but after that, with amendments, we don't need to see that clearance letter. And then you'll head over to InfoEd, which is era.cu.edu, to submit all your documents. If you've never used InfoEd before, I recommend you go to a CTSA class, just doing an introduction to InfoEd. It's kind of a difficult website to work with. There are a lot of buttons that don't work the way they're supposed to, or sometimes the page won't load. So that class just kind of, it's led by our lead trainer, and she will just point out where all of these kind of glitches happen so that you don't run into them when you're trying to submit and you don't know how to work around them. You can also, if you can't make it to that class on time, you can reach out to our help desk and just set up a time with us. We usually do 30-minute windows, so we can go over how to actually load your documents into InfoEd, which tabs you'll actually be needing and using. So you can just reach out to us and say, I need some help submitting X submission for this study. Can I meet with somebody? And we'll message you back and plan a time to meet. And then once you submitted your documents, it's our half. So this is kind of what we do behind the scenes while you are waiting. So your submission gets added into a queue. It's typically split up by panels. So panel A, each panel has their own queue. There is, for exempt research, a specific queue where it's all exempt and non-human subjects research. That's the queue that I mainly work out of, as well as the panel D queue. But essentially, they just come in first come, first serve. We have some priorities. So UAPs get prioritized over amendments just because those are things that may have caused risk or harm to a participant. So we want to make sure that we have that in our general scope of knowledge as soon as possible, whereas amendments sometimes are just adding a couple words to a recruitment email. So those are lower priority. If you ever have an amendment that is higher priority, you're like, I need to get this consent form approved because I have someone coming in next week in the morning to be consented, you can reach out to the help desk or to whichever staff member you already have a working relationship with and just let them know, and we'll make sure that we meet that deadline for you. But essentially, once it's up to its turn in the queue, a staff member, a coordinator, or a specialist typically will pre-review the submission, and we're just looking to make sure that the documents are all consistent with each other and that you haven't missed any section. So sometimes people will forget an attachment on the application. We're checking to make sure that the application is fully filled out before the reviewer even sees it so that there's less back and forth. And then we're also making sure that if your application says you're consenting 15 people, that your protocol also says 15 people. Sometimes as documents are updated, there's some inconsistencies before you even submit to us. So we just want to make sure that they're all consistent. But once that staff member has done the pre-review, they will reach out to you, ask for any updates that are needed. And once they deem that the submission is ready, they'll send it off to a chair or they'll put it on an agenda for full board review. The chair reviews are reserved for expedited studies or amendments to full board studies that are lower in risk, as well as exempt studies. And then full board is for greater than minimal risk and any amendments that are changing the risk level for that study. From there, the chair or the board will review the submission, complete a checklist, which just double checks to make sure that the study is still meeting all of the regulations it should meet. And then they will communicate that back to the coordinator or specialist, who will then make all of those updates in InfoEd, build one of those big letters that you get, and then they will actually send you that determination letter. This is also a process that's a little bit sporadic in terms of timing. Sometimes the review can happen super quick. We have submissions that are called just in times, where you're submitting, but your funding organization wants to know that you have the approval before they release the funding. So we have to get that approval really quick. For those, there's less of a pre-review because we have some space to require those changes after we give you the approval. So we'll give you, here's your really quick IRB approval, but before you can even interact with humans, with any subjects, before you can touch any data, you'll have to submit an amendment to give us all of these changes. So that just in times, we've gotten them done in a day. Sometimes studies can take a month for approval just because if they go to full board and the board wants to see some changes, it'll go back to the study team who can then make the changes and respond. So in general, we just ask that if you have any deadlines coming up, you let us know so that we can prepare for them as much as possible. And if you don't have any deadlines, but your study is taking a little bit longer, you can always reach out to ask us to say, hey, what's going on with my study? You know, maybe your PI is on you trying to get that approval letter. We can go ahead and give you an explanation. We'll break down where the study is in the review process so that nothing is kind of a mystery to you in terms of this. And just, you know, be patient with us. Sometimes we have a really large influx. A lot of times what happens on panel D is we'll have some lengths of time where we have like no studies being submitted to us. So we are cranking out approvals really quick, right? Because we're not working to catch up to anything. And then there's times, typically at the start of the academic year, where we get a lot of submissions, and there we ask for some more patience so that we have time to work through each submission and make sure that each one is up to standards. And then if you ever have any questions about your studies, like I said, you can reach out to our help desk. It's for specialists, the managers and leadership that have access to the help desk. And we try to respond within 24 hours. Sometimes it might be 48. Sometimes it might be an hour or 30 minutes. So we're pretty on top of it. But if you want to just come in, drop into our office hours, we have them 12 to 1 p.m. every Monday on Zoom. And you can register by going to our website. There is also, I believe, an email that gets sent out twice a month with the link to register. So you can do it there. And then you can always reach out to any staff member that you've worked for before. One of the biggest parts of our office is customer service and making sure that we're providing you with adequate customer service. So I know I speak for myself and all of the managers, coordinators, specialists when I say we love working with you guys. We love taking kind of any issue that you have, working towards a solution, and then working towards your IRB approval. So yeah, we're all looking forward to working with you, and that sums it up for my presentation. If you guys have any more questions, I'd be happy to answer them.